Hello. Good morning, everyone. We have a good group today.
Good morning.
Morning, Joan.
I love that
David.
David dresses up for these things.
As I say, David looks pretty dapper, doesn't he?
He's the professional one of the group.
Kidding.
I'm giving another minute to the typical 10:02 because that's when a lot of people like to show up for some reason. I guess they've gotten used to it. All right, well, it's almost 10:02, so we'll get started in a second here. We've got 20 people. More than that. All right, so I'm gonna mix it up and start 18 seconds early today. So happy Thursday, everybody. Thanks for joining. Just to let you know, Brian is taking a well-deserved break of a couple of days, so he will not be on with us today, but Don is here to help organize this call. Let me see, we're up to 21. And so we've got our topic today about reopening plans, and Don's going to talk about that. And I think Mindy will have something to add about the organizational capacity workshop she can remind us about. But first, I'll let Don take it over so he can get David going, because I think spring break starts today, so David's probably busy.
Yeah, and whoever wears a tie gets to go first. Can he hear? David, can you hear us okay? Can't hear him. Oops. Okay. Well, we're gonna start with David so that David, are you there? Okay.
Yeah, the internet's great when it works.
Yeah. Yeah. Okay. David, are you there? Or is he probably coming back in?
I see him.
Yeah, I see him. David, can you hear us?
Let's see. He's moving. I'll do a play-by-play. He's moving. He's walking. He's got a lovely tie on today.
Beautiful tie. Nice. Based. There we go. Oh, he's on his iPad somewhere. So while we're waiting, I'll just throw something in because it's just as a reminder to everybody. David, whenever you come in, please let us know, and we'll go to you. There won't be a call next week. Instead, on Wednesday the 17th at noon, that's the second session with Nanette Friedman. I think, Mindy, is that what you're going to be talking about? Yeah. Mindy, why don't you go ahead while we're waiting for David? You want to go ahead and talk about it?
Great. Really quickly, I hope all of you are aware of this and have shared it with your staff, with your boards, whatever leadership you feel would be appropriate. We would love to have you join us. Nanette is going to be speaking about financial resource development, making the ask, and donor stewardship. This is something that we heard a lot from all of you in our capacity building survey, that this is a skill that you would like to build within your organizations. So quick summary: are your staff, board, and development committee comfortable asking for philanthropic support? Come learn step by step how to make the ask and practice role playing both as a donor and a solicitor in this interactive session. We'll also discuss the imperative of donor stewardship now more than ever. For those of you who know Nanette, she's really great, really interactive. I think anyone who participates will get a lot out of the session. So I really encourage you to attend and encourage you to share the information with your staff and leadership.
Okay, thank you. David, are you with us yet?
I am sorry about that. Somehow
No, that's
I had
okay.
some
That's okay. We were making fun of your tie, so
technical
you're fine.
problems here.
You're all right. No, I'm just kidding. It looks great. So you want to go ahead and we'll go ahead and let you do your update so you can go on and do other great things for the community.
Yeah, well, I'm not sure that's worthy. So we are getting ready for spring break. Just so everybody has a kind of a sense of what's going on. Now that we have the federal bill that's been passed, the state is trying to figure out, okay, what can we spend it on? How can we spend it? A couple of really interesting features about that bill that are just now coming to light. One is that the state actually has until December 31 of 2024 to spend the money, which is a huge increase over what it was. So that gives us roughly 3.5 years versus like 18 months to 2 years, which could make a massive difference for us. Second, there's a provision that the Democrats put in at the very last minute that was kind of a counterbalance to the Republican provision about not using the resources for pensions that says that no state can cut taxes if they want to draw these dollars down. So that actually is going to be a huge help because the state's been seriously considering making some massive cuts in tax levies. The other day, the Senate perfected a gas tax. It's interesting because the gas tax is, I think, 2.5 cents a gallon, but it also has a rebate for Missourians. So the theory is that most Missourians won't ask for a rebate. It's kind of like a European VAT, but like the truck drivers that are driving through the state of Missouri will have to pay the increased tax and will not have access to the rebate. There was a big deal that was brewing late Monday night, and that included all kinds of other really bad stuff. Senator Eigel tried to perfect a bill that night that would have gotten rid of the personal property tax, which funds schools and all kinds of other stuff. And that would have been, I mean, nobody actually likes the personal property tax, but it is our system and we rely on it. And so that bill actually failed. And then the Wayfair tax provisions, we brought those back on Tuesday and that passed. And actually it passed in fairly good shape, letting local governments capture internet sales tax and use tax. The only problem with that is that they also included additional tax reductions from Senate Bill 509, which is the income tax reduction that passed. And so they put another 4% to 5% or 0.5% of a reduction. So our state income tax will go down to like, I think 4.7 or 4.6 after 509 goes through. So that's not great. And we'll kind of see where we end up with that in terms of just the state's sustainability. We are talking about the state right now getting something between $6 and $7 billion coming in. The money is probably going to be locked down into a specific fund so that legislators and appropriators can figure out, okay, here are the kinds of things we want to spend this money on. We fully expect a massive set of capital improvements to be pushed out in capital investment. The interesting thing is that roads and bridges are off the table. They're precluded from the federal bill because we expect a big infrastructure bill coming in behind this thing in the next 6 months. And of course, you know, you all, probably the politics are important here, that I think the Biden administration expects to lose the Congress to Republicans in 2022, which means they have like an 18-month window to get all the stuff they want to get done before things drop back down for them again. So that's where things stand right now. There are a ton of bills that are moving around, but not a lot is passing, frankly. Last night, for those that are on the call that are interested in this, and we'll talk a little bit later with the defense agencies, we had initiative petition legislation passed last night that would obviously alter voting. This is a big Republican priority across the country, as you all have probably read, to try and reduce the ability for you to be able to put initiative petitions on the ballot, as well as kind of requirements we put around voting ID. And you're actually seeing in Congress, the Democrats are looking at kind of a more a more consistent package on how we allow for early voting and things like that. So I'm going to stop there. Try and answer any questions folks have. There's obviously a ton going on. I know that several of you reached out about earmarks and a couple of other things. I know we've had a couple of conversations about those. What I want to just tell you about earmarks is this will not be the only year we see them. So for those that are really thinking about this issue and you've got the size and scale to think about it, one, I would take advantage of the JFNA and Don and Karen and their team. I know you guys have put a ton of work into some of this stuff. And I think that learning process is really going to be helpful for you all. And two, don't go into an earmark setting with kind of an idea. Go in with a really thoughtful, well-demonstrated plan. Remember, you're going to be kind of in the news. You're going to be competing against a lot of other folks. The transparency requirements around this dictate that, you know, we read these things 150 times before we put them forward for folks. And so that's I think very important. Also, I know Scott and his team are working dutifully on the nonprofit security grants, and we're going to try and add an assist on those both at the state and federal level. But his team's got a great handle on this. And I don't know exactly where we are in the process. I'm sure Scott will be able to tell you, but you know, I think that's an avenue for us where we're going to be able to pick up a lot of assistance from the federal government, at least in this program. So Don, I'll stop there and see if there's any questions or anything like that.
Yeah, does anybody have any questions for David based on what we just talked about, or anything else that you'd like to ask him? Anybody? I'm trying to see. I think I can see. All right, David, thank you.
Yeah, my pleasure. You all have a great day.
Thanks a lot. Bye-bye.
You bet.
But
Okay, so one of the things, and because David mentioned it, and Scott, the next topic, which we're going to spend the rest of the meeting talking about, is just getting everybody's thoughts. And then I should say thoughts there. Maybe everybody just give us an idea, if regions, for some of the institutions, what it is, what your thoughts are in return to. I don't want to, I hate the term return to work, because I don't know about, I think most people probably been working just as hard, if not harder, than before COVID. So it's returned to some level of normal operation or new normal operation. So, but before we do that, what I've asked Scott to do is to just give us a quick overview of what the city of St. Louis and the county guidelines are right now, just so we're, if you could refresh us. But before you do that, Scott, if you could just real quickly, is there anything regarding the security grants that David mentioned that you want to share with people about process or any timing or anything like that?
So there actually is. The state of Missouri did release a tentative deadline of April the 16th, close of business. So that's actually good news, because we haven't hit March 16th yet. We were worried that there was going to be a quick turnaround because the state didn't immediately respond when the federal government released this, but now they have responded, and we have over a month now to be able to submit those applications. That's tremendous news. Although our community is really excellent at doing all of the work. So we're really far along. We're going to be in very good shape.
Okay, great. So if you have any questions around the grants or assessments or timing, let Scott know, and he will, as usual, do his great job. Keep trying to help us get as much as we can and make sure we address the needs. Okay, what I want to do now is let's jump to the discussion about return to work, return to normal operation. And Scott, if you could just give us an overview of what the guidelines are from the county and the city right now.
Sure. So on March the 8th, just a few days ago, the county did issue a 4th amended Safer at Home order. For those of you not familiar with that, it's a document that's designed to issue what restrictions are out there in terms of what the county would like to see regarding business activities, people outside of the home, and emphasize the safety of the home and our bubble groups, work from home, those types of issues. So the document both emphasizes work from home and but then also provides guidelines for organizations that are not working from home. So there is an active document out there. So no matter what we do as a community, we're still going to have guidelines from our government organizations that we're going to have to work with. I'll just give you a few highlights of what that order looks like, and then we can sort of talk about maybe a little bit about where we're going as federation in terms of developing some further guidelines. But for instance, a person may be outside their home to work when they cannot reasonably do so from home. So that sort of applies across the board to everyone. So if you have the ability to do your job from home, the expectation is, even now, is that you do it. So there hasn't really been a loosening of restriction in that. You can still attend worship services, funerals, related events for someone who's died, or visit a burial ground. So, for our synagogues who have funerals services, for our cemeteries that are engaged in those, there is an exception for that. You can come out to exercise, so that's a big deal for the J, because that is something that's being allowed. And then with all of those things, all of the standard CDC guidelines for precautions do apply. So you're expected to maintain social distance and wear a mask, even engaging in those activities. In terms of gatherings, which is a lot of what people have been asking us, hey, when can we do this? When can we do that? The gathering numbers are still logged in at 20 for indoor activities and 30 for outdoor activities, unless there's a specific section in the order that addresses it. For instance, businesses that provide goods and services. We certainly have service providing businesses, 50% occupancy for those. And then, of course, there's expectations in terms of things like events, banquets, those types of things. They can only have a 25% occupancy. And it could even be less, depending on if they cannot obtain appropriate social distancing for tables, for instance, at tables. So you may have bubble groups, but and 25% occupancy may be 100 people in a big ballroom, but if they can only do 60 because of the way the tables are spaced, then that's the expectation. In terms of outdoors, we talked about the 30 people outdoors, where there's an event that's going to exceed 500. So that'd be a space that can hold 1,000 because it's 50%. Where there's a space that can hold, or an event that's going to exceed that, there's a special plan that has to be submitted. And then there are areas that are not subjected to the 50% according to the new order. That would be daycares, schools, and other professional organizations. And I sort of cut through a lot of these. There's many more, but these are the ones I felt applied to us, or organizations without direct public interaction. So definitely our ECCs, our schools, and possibly some of our organizations that don't necessarily have like a walk-in visitor type, environment. We could probably still function in those. So we're going to continue to look at these guidelines as we move forward. What Federation has chosen to do is to take our existing document that we created early on, which we feel is fairly robust. It covers many things, and we're going to look at whether or not we can move to a new phase, if you will, but it will be a phase based on the county and city orders, as well as any other CDC information that's been put out there. And that's kind of where we are at Federation.
Yeah, thanks, Scott. I think it's just that one of the things that, again, and Julie Gibbs and her team aren't on here, but we're getting a lot of, and Karen, I know people are ready to start engaging again, and I know we're getting, there's some constituents that really would like to see us back in face-to-face meetings and things like that, and so we want to be purposeful in our review. And, one of the things that's come out of the guidelines now on the interactions between vaccinated and unvaccinated people. And those are the things that we're now going to be incorporating into that document, because I think the news, if everybody got the other day, the news flash that the CDC said if you're vaccinated, you didn't have to social distance and you didn't have to wear a mask. Well, what the story didn't say is that if it's in your pod or it was not quite as open. So we want to incorporate those CDC guidelines into ours. And as soon as we have that, hopefully in the next few weeks, we'll be sure to share it out with everybody that's here. What I'd like to do now is see if there's, it's just kind of see if there's anybody, one of the things I realize also, we have a real diversity of organizations in this group. And if anybody has any, has maybe made some decisions or maybe, taken a path forward they want to share with the group, I'd be happy to hear from you now if you'd like. Is there anybody? Oh, anybody?
Looks like there's a question there, Don.
Oh, sorry. Let's see. Well, public education events like schmas,
Shulamit, were you meaning in person, not Zoom?
you're
You may be muted.
You're muted. You're still muted. Oh, there you
As
go.
a good citizen, I'm muted. Webinars are prolific, and thankful to Mirowitz and whoever's doing them besides them. But, we miss social interaction. So will there be the JCC meeting rooms or Mirowitz meeting rooms where 10, 20, 30 people can gather spaced out to have a cup of punch and hear speakers?
I think that is exactly what we're going to try to ascertain. I think
Yeah,
we're going to look at all the guidelines, do an overlay, and that will require meeting with other entities. I mean, you mentioned the J. We would have discussions with Lynn about whether the J is comfortable with that, even if the guidelines apply. So but we're going to look for those spaces where that would be possible and see if the guidelines can allow us to do those things.
Yeah, I think we, from a federation standpoint, we will look at sites that are in our building and try to, create a path forward to open those up as best we can. Just as a point of reference, we had a discussion with an event planner last Friday, just because we've got a couple of major events that we're thinking about later this year. And it was interesting to get their take in that. He said that people are really, and not people in the Jewish community per se, but like we're talking about, everybody's favorite location, the Ritz. I know. He said, but people are starting to really plan forward the events that by, starting in July, they're starting to see preparations for like a 50 to 60% capacity. And he's thinking that, we're thinking about a December event for the museum. And he's thinking, he says that we should, maybe 75% to 80% capacity. And most of that is because of just people still not willing to go out at the numbers we did before. Now that said, so what that to me was, he said there's a lot of activity of people trying to get back to in-person events. So there's some momentum outside of our specific experience. So I just wanted to share that we're not, while we're being cautious, but there's other organizations who are really starting to plan out for the rest of the year and really thinking to be close to normal by the end of the year. But that's just based on the feedback from the event planner, who probably wants us to plan an event so they can have business.
Well,
think
and I
that-
know that the rabbis have talked about the different synagogues and when they'll open and there are no in-person
Right.
Passover Seders. And I've got some weddings being asked about in, Chol Hamoed, Sukkot, and not in a synagogue, just, people without a congregation. So those are questions I'm listening ear to the ground. Thank
Yeah,
you.
we will keep, yeah, Joan.
Yeah, I just also think that there are different kinds of events. So obviously, if
Yes.
people are eating, they're not wearing a mask, right?
Yeah,
So the criteria around that might be different. And just also, I'll just share a conversation I just had yesterday with about a 70-year-old healthcare worker who was vaccinated because she's a healthcare worker. Her husband was not vaccinated. She ended up testing positive for COVID, even though she had no idea she had it. He became very ill and is in the hospital now, very ill. So the fact that some people have vaccinations and some people don't, and that you can be a carrier even if you've been vaccinated, I think we all need to really stay in touch with the guidelines around this.
right.
I think we still have a little ways to go before we can ensure that everybody who's at an event can be there safely. And of course, then there's also the question about, can you mandate that somebody shows you a vaccination card before they come to your event? And what are the legal things around or reputational issues around that?
Mhm.
Joan,
Well-
all excellent points that, in fact, we had a short meeting yesterday with our COVID group, and Federation has always taken the stance to be actually even more restrictive than even sometimes CDC has been in terms of their guidelines. And all of the points that you made came up, that the carrier issue, the vaccination issue, the not being able to ask for, a vaccination card, if you will. So yeah, we have bullet points on all of that for discussion.
Yeah, and I think that the idea of I mean, for us, it's even, our folks wanting to do like individual interactions, and how do you know? Do you, we're going to be developing guidelines, there's at some point somebody says, yes, I've been vaccinated. You have to, I guess there's a trust factor. But those are things we'll have to do our best at.
I would also want to know about the legal liability to each of our organizations, because when we talked to David Winton last week, he had said the legislation that perhaps was going to go through to protect each of our organizations, he said didn't come through. And so, I had a follow-up about consent and consent forms and how do we protect ourselves. And he actually had suggested, well, that's really something to talk to an attorney about. And so I think that should come into the conversation about if I have a super spreader event, what is the legal liability to our organization? So.
Yeah, and yeah, we could find some, maybe bring someone to the group and have them talk to us. I think we'll take a look at that. Yeah, Ellen.
Well, I also think we have to be cognizant of all the guidelines for sure. But for a lot of our organizations, the folks that we work with and serve are significantly older than our staffs. And so they may have been vaccinated while our staff has not been. And there has to be above and beyond the rules, there has to be a comfort level among your staff as well, that they are willing to come back and work either in your office or in person. And I think we have to be really careful about that, because while one person may be like, oh, it's no big deal, I'm going back to work, another one may be scared to death to walk in the office. And how do you balance that in terms of taking care of your staff as well as providing the services that you need to provide as an organization? So we're building a lot more flexibility into our personnel policies than we ever had before about working remotely. We're not doing any in-person events until April of 2022 in terms of a big event. So we've pushed it off a full year, given the average age of the population that we work with and our members. And right now, we have no meetings in person. We are talking about allowing meetings in our boardroom, 10 people or less, because in that room, each one of them can have their own 6-foot table away from somebody else. And that would be the capacity that we will allow, at least in the near future, is what I think is going to happen for us.
Yeah, all very important considerations.
Yeah.
There was also an article in the New York Times a few days ago about the risk of eating in restaurants. And actually one of our staff people called it to my attention and said, that there are other staff people that they work with that are eating in restaurants, and that's caused this person unrest working side by side with them. So I think there are many issues. And Ellen, you raised such a good point about it's not just our constituents, it's also our staff who are asking to be at risk when we do these things.
Yeah, I think the thing it's kind of the flip of where we were 6 to 10 months ago, or even recently. And that because with us, the older group is the ones that have gotten the vaccination and they're ready to get back out. And then we've got the younger group who haven't been vaccinated yet, which, and as you said, we have to be very protective of. And so it's versus the others where the older group was perceived to be at higher risk. I think it really, I mean, a lot of it really depends upon the vaccination rollout and we see that pick up because, it has not, I think, Missouri, I think is, and I live in Illinois, so, but Missouri is not, particularly locally, I don't think it's been a very dense rollout, so.
What if some people decide they don't want the vaccine, right? Because they've had it offered to them and they don't want it. So then as an employer, how do we manage that? Because perhaps, I don't know, the coworkers might not feel as comfortable, or, there's a whole question about that as well. Yeah,
and we actually have, we've had some people say they don't want the vaccine. The question, and again, this is part of the process as we start to work through these what if questions. At what point does somebody's unwillingness to get a vaccination become an impingement on their ability to do their job? And I think luckily we have more flexibility today than we did a year ago. But it's and maybe there's some positions where that's not an issue, but finding that spot, I think is really going to be something we all have to figure out as we go through this.
If it's helpful to others, and obviously you probably all have your own resources, but I have discussed this with our employment attorney, and his advice at this time was to, even in our industry, we're working with older adults, vulnerable people very much in their space. He suggested that we should not mandate it.
Yeah.
He said, you have to mandate the policies of mask wearing and hand washing and just social distancing. But he said, unless you are willing to terminate the employee, he said, I would give it some time because you might find in the next few months there will be a higher level of adoption of the vaccination when people have had more time to see how people are doing with it.
Yeah.
So, he basically said, are you willing to terminate their employment? Because that's what you would need to do.
Right. And that's similar to the approach, Joan, that we're taking at the Federation, and that, we're not mandating, but although I guess you have the right to mandate according to the law, but we're not exercising that for the reasons you said. It's a real personal issue for some people. So,
Rabbi Novak.
I just want to drop a tiny suggestion. If you have an employee handbook, at least for new hires, you could probably mandate for the new hires potentially going forward without significant repercussion. And so even if existing employees are on the fence, at the very minimum, you can choose intentionally to make it a precondition for employment going forward. And so sooner than later, people will either get the hint or get weeded out. And at least you won't be hiring sort of, or say problem cases, but people who are not excited to work with others, proximity.
You probably want to be careful how that's written, because there are circumstances in which someone cannot, it's not safe perhaps to be vaccinated, and then that could be considered discriminatory. So just there are certain questions and
just check with your counsel for sure.
Yeah, many considerations. I've taken notes from everything that's been said today to take back to our group, and we'll definitely be looking at all aspects of this.
Anybody else? Anything else we're not thinking about? Oh, yeah, Nikki.
Yeah, I just, since we were fortunate to be able to have our staff vaccinated and our clients that wanted to be, we were hoping that we might be able to sort of be creating a pod of people that we know are vaccinated, and you know, to be able to open up a bit still with the guidelines being followed. So that's part of our, you know, consideration in there. And I think that piece of it where vaccinated people can be together, sort of like with Israel, where there's the you know, internal passport kind of thing. You know, is there a way that we can fairly and legally and securely incorporate some of that into how we phase things in?
Interesting.
Yeah,
I'd love to hear from, you know, if
yeah.
people are thinking that way.
I spoke with an organization I belong to that's a national organization of senior communities, and this very question came up with the understanding that some people, that will always be people that were not vaccinated, and the recommendation there was you want to be really thoughtful about saying you can only attend if you've been vaccinated, that could become a discriminatory lawsuit. So, I mean, everybody needs to talk to their own attorneys probably, but that was the general feedback that I received on that.
I've got a quick one. Scott, I know you were running through a bunch of the numbers of groups that can gather.
Mhm.
We're thinking as the weather gets nicer of having, you know, moving some services outdoors. What was did I hear 30?
Yeah,
Is
so
that-
it's a pretty significant number when you start to go outside in terms of that. So the document's a little contradictory. You can go up to, for some outdoor events, and this is based on I don't know how they get occupancy for outdoor, but I'm assuming they're talking about like venues, you know, like concert venues where there truly is an occupancy. Depending on your space, if you can maintain social distance, the county doesn't require a plan unless you exceed like 500 people. So you can have a pretty significant, I know I've attended one of your outdoor functions there already, and you know, you had maybe 30 or 40 people, and that was fine. You had plenty of social distancing. It was well thought out and well put together. I think you would be fine with those.
Okay, great, thanks. So it's really, as long as we maintain the distance between seating, it's really whatever this space holds.
Yeah, all of those mandates still apply. Mask and social distancing apply regardless of what event you're looking at.
Great, thank you.
It's an interesting thing, if I can, that when you're talking about funerals, people don't adhere to those restrictions. And so we have to put that more strict protocol in so that we can protect the employees as well as the participants, because even we're allowing up to 30, but we're not having a tent, so that we can have social distancing. If we have a tent, then only 10 can come. But even so, they gather and they take off their masks and they hug, and there's nothing much we can do. As far as what somebody was talking about, as far as vaccinations with employees, I checked into that because my employees absolutely do not want to get vaccinated. And so basically, I forced them to sign up, but I did not force them to accept it or to schedule. What I was told is we give them every opportunity to get vaccinated, and that way we're covered liability wise. And it's their choice whether to do it or not. I myself am getting vaccinated. I'm getting my second one, and my supervisor is too. But you know, we're a small group. So as far as the CDC guidelines, with having vaccinated people with a few unvaccinated people, we're fine with that. But it's when we have our funerals that's going to be an issue, whether we can relax them even further if they opt not to get the vaccine. So, you know, I'm still working the legalities of that. That's all I have to say.
Yeah.
Anita, Anita, you already have guidelines that you put out to the families.
Yes.
You know, you can't, you know, we do the best we can to control activities, but you're right, there's that moment. And remember CDC talks about that extended close contact time period. Unless it's a 15-minute hug, you know, you're probably according to CDC, at least you're probably fine with those sort of quick group hugs and then they dissipate again. So you can only do the best that you can do.
Yeah, they don't dissipate at the end. They haven't seen each other. It's a family reunion and with friends and
Right,
family, so they kind of hover around for a while. But yeah,
Yeah.
you do the best you can. So
Thank you, Anita. Anybody else have any thoughts, input? This will be an evolving situation, I think, as we all try to figure this out. And we will, again, Scott mentioned, we put together our phased approach last spring that we've been using. And really, we haven't gone past phase 2. I think we went to 2 and then back to 1, and we're probably closer to phase 2 now. But it's going to be an interesting couple of months, I think, and I'm hopeful that we start to see vaccinations, particularly in the region, start to pick up a little bit. That will help a great deal. When you start to see things like 30% capacity at baseball games, and I haven't heard if the Blues are going to start. I mean, I think it makes it harder, to be honest. It makes it harder for you to say, well, we're still not open. And I think that's the challenge I think we're all going to start facing pretty soon here, and then just be smart about it. So if there's anything else, any other questions, or if there's any, as people have thoughts or questions, if you want to email them to me and to Anna Marie Womble, we'll try to. This will be an ongoing discussion. I think what we will do is try to find somebody who can talk about the legal issues on a broad basis, because again, each institution is different. As I still always, everybody still consult their counsel because they know their institution probably better, but we'll see about finding somebody who can talk about the legal liability components. And I think also is clarity around vaccination, how vaccinations affect how we roll things out. Those are all components that we'll bring in as well. So is there anything else before I hand it back to Greg?
Yeah, Don, this is Jen Schmitz. I just wanted to add that I sent Anna Marie a template of what we're using at the Merowith Center and Covenant Place, which might be helpful because I broke it down by like some of the different areas that people might not be thinking about. So I just want to let you know that.
Thank you, Jen. Yeah, we'll include it with the when we send the email out with the notes. Thank you. I forgot about that. All right, Greg.
Awesome. Thanks everybody for being here. As we did before, we brought in an expert, as Don said, we did previously bring in an expert around the legalities of the vaccine with HR, again, to talk about his perspective, but then you all should do that relative to your own organizations. And I think that we can try to find someone relative to facilities and events, again, knowing that not every facility and not every event in our community is the same. And we are going to be subject to things like peer pressure from people saying, but wait a minute, the baseball stadium's open for 30%. Why can't I do this with you? And given the fact we have such vulnerable differential populations across our community, it's going to be difficult. I think the beauty of meetings like this and these calls that we have every week is that we can look for the best answers for all of us and work on this together. So I very much appreciate your continued participation. Reach out anytime to Don or Brian or me or Mindy. A good early Shabbos and a great weekend. And we'll hopefully see you all at the call next Wednesday on fundraising and development capacity building.
Thank you, everybody. Bye-bye.